The new therapies that have come about in the last year or so, including back in 2017, these new therapies actually provide new treatment options for one, patients who may have failed current therapies and didn't have any other options to choose from, and they had to rely mostly on blood transfusions, or for those patients for which they tried the new therapies and they just didn't work. And outside of that, there were no other options. So with these new players that come to the table, we've actually increased access to treatment options and also provided treatment in areas where there once probably was not an option. One of the biggest issues that I have come across in speaking with patients is that while these products are available on the market, they're not available to them. What that means is they may not be available via their formulary options for their insurance carriers. And even if they are available, the cost of them is prohibitive for some being able to access. So if they're not aware or not tied into patient access programs, they still are not able to reap the benefits that these medications provide. I would say for my discussion at AMCP Nexus, it's definitely something that all payers, no matter what your role is in the insurance company, whether you're the claims payer, whether you're the formulary decision maker, whatever your role is, this is definitely a discussion that you would want to take part in, because oftentimes sickle cell disease patients are overlooked, or the disease state of treating sickle cell disease, because it doesn't affect a large number of people. It's not really something that a lot of people spend a lot of time on. But at the same time, patients who have sickle cell disease, to treat a sickle cell disease patient costs a significant amount of money. So therefore, this is something that while it may not affect a lot of people, you definitely want to pay attention to make sure that you're treating these patients appropriately, because their disease states can actually push your budget, pushing your budget to the point of, okay, what are we going to do to help control the cost in this particular area? So I would share information on helping you determine, when you go to add medications to your formulary, what are some things that you need to look for when you treat sickle cell disease patients in general? What are the additional things that you need to look for in addition to sickle cell disease, other conditions that affect sickle cell disease that you need to make sure that you're treating appropriately, or making sure that you have equitable access to. We also will discuss budgetary constraints associated with sickle cell disease. We talk about how you can incorporate these medications, and at the same time making sure you're using funds judiciously. So those are definitely some things that would help you in going forward and taking care of sickle cell patients.